The Ebola crisis that we're seeing right now, the epidemic in Africa, started more than 6 months ago, just as isolated spread in West Africa, and they thought they had it contained. They thought they actually had diminished a lot of the continued spread of the virus, and then the epidemic flared up again. The outbreak grew and it turned into an epidemic, and several things made it different this time. I think that allowed it to become a much more widespread epidemic than we've ever seen before. I think we're going to be dealing with this epidemic of Ebola in Africa and potentially other parts of the world a lot longer than we think right now. As far as the U.S. is concerned, there are things obviously that we could be doing to prepare ourselves much better for what are inevitable cases that we're going to see here. From the standpoint of what the U.S. should be doing, the number one thing is get more resources into West Africa, mobilize the international community to get healthcare workers and other resources in to stop the continued spread and slow the rate of transmission in West Africa, and do what we can also to prevent it from spreading to other parts of Africa, because that's a real big risk. If it spreads to Nigeria or other countries, then it's going to be very hard to prevent a global pandemic. I think here in the U.S. we should be making sure that the policy questions that touch on this issue are resolved. For example, what do we do with medical waste that's infected with a hot pathogen? How are we going to implement a quarantine authority? The regulations around how the CDC and the federal government would implement a quarantine authority haven't been updated in literally decades. And so a lot of key questions haven't been thought through. For example, where will we quarantine people? How will people get out of quarantine if they're being quarantined against their will and don't think they've been exposed? Will they be quarantined with other potentially infected individuals? Because if I'm an individual and I think there's very low risk I was exposed, I don't want to be around people who might have a higher risk if they were exposed. These questions haven't been fully thought through, and that was evidenced in Dallas by the fact that when this family had to be quarantined, they didn't know where to put them. And finally, I think we really need to think about a therapeutic in the context of the current outbreak. A lot of people say, well, even if we get a drug or a vaccine, it's not going to be available in time to affect this current outbreak. I think that's not true. I don't think we could know that. First of all, if something works, if an antiviral drug or a vaccine works, you can get proof of concept very early. You can find out whether it's working based on clinical trials that involve small numbers of patients, and we know that that is generally true of therapeutics aimed at infections, bacteria, viruses. You find out if they're working very early because you don't have to wait long to see if it's killing the virus or the bug that you're targeting. So one, we could have a drug available sooner than we think if a drug comes along that's very effective against this. And second, we could be in this a lot longer than we think. And so to say that, well, this is going to be over in 9 months, so we're not going to have a drug available in 9 months, that's just not true. We could be in this a lot longer than 9 months, and so I think we need to be thinking hard about how to accelerate the development of these drugs with the premise that we might need it to deal with this current threat.